All right. Good morning, Indianapolis moms. I'm Kate, the owner of Indianapolis Moms, and I am so excited to be here with Dr. Sanford today from Hancock Dermatology. We are going to chat about sun safety. I know that's something that you are very passionate about, correct? Dr. Sanford? So before we get started, will you just share a little bit about yourself? Tell us who you are, how long you've been with Hancock Dermatology, and what led you to this profession?
Sure. So I am a board certified dermatologist. I practice out in Greenfield, Indiana, so just outside of Indianapolis. I have been practicing medicine for the last 7 years. I guess what has always drawn me to medicine in general is just taking care of people, but dermatology in particular, we get to take care of individuals from birth until death. So this, of course, includes children. And as a mom of 3 little ones, ages 8, 4, and 2, I have really enjoyed pediatric dermatology, and sun safety has been very important to me because I have to make sure that I take care of not only myself, but also my little ones.
I love that. I love that. I also have 3. I have a 9-year-old, a 6-year-old, and a 4-year-old. So I feel this. So let's go ahead and get started. I want to ask you about SPF. So I think that's something that a lot of people, don't use and they should be using. So go ahead and share with us, is there a certain number that we should be aiming for as far as SPF?
Yeah. Absolutely. So I think one of the misconceptions about SPF is that the number on the label is how much of the sun it actually blocks. That's not true. There is a formula that we use to calculate how much UV is blocked by a sunscreen. So in general, most dermatologists suggest that an SPF of 30 or higher is adequate to protect most people from the majority of the sun's rays. So an SPF of 30 actually blocks close to 97% of the UV rays that you get in the sun. So SPF, anything above 30 is really adequate. It's more important that you have a sunscreen that you like so that you'll reapply it and remember to put it on before you're outside.
Perfect. So is there a need to wear sunscreen all year long? You hear clearly in summer, yes, we should always have sunscreen, but what about like winter and fall when the sun's not as hot as we think?
Mm-hmm. Certainly. So, there are different types of sun damage that our skin receives. So there's the day-to-day UV exposure. So driving in the car, walking to get the mail, even short periods of time outside, we do get some UV damage. I think what most people are more aware of are the blistering sunburns that cause you to get red and peel and are more uncomfortable. But in reality, the day-to-day sun exposure is also contributing to chronic damage and changes to the skin. So sunscreen in the wintertime is important. You may not need to reapply it as often if you're not spending as much time outdoors or where you can be exposed. But most people are commuting to work even during winter months. People do go skiing and spend some time outdoors during winter months. So I think that it's easy to remember that sunscreen is important during the summer, but there are times where you should also be wearing it throughout the year.
Great, thank you. So as far as skin type, this was something that a lot of our readers were really interested in the post that you just shared with us. So is there a skin type that's more susceptible to skin cancer? And I know you had also talked about how different types of skin type or different skin types actually tan differently. Can you elaborate a little bit on that for us?
Yeah, sure. So human beings all have differing amounts of melanin in their skin. So those of darker skin types have higher concentrations of melanin in those top layers of skin. Those with blonde or red and very fair skin have much less melanin or a different type of melanin in their skin. So melanin's job is to reflect the sun's rays and help protect your skin from absorbing that UV damage. So those of darker skin types are at lower risk of developing skin cancer long term. In the dermatology world, we use a term called Fitzpatrick skin type, and patients range from type 1, which is your red-haired, fair, blue-eyed patients, all the way to a Fitzpatrick type 6, which is a very, very dark complected individual with dark hair, dark eyes, and dark skin who has to spend a significant amount of time in the sun before getting a sunburn. A misconception about skin type is, though, that darker skin types cannot get sunburn. They can get sunburn. They may not be as noticeably red, and it may take longer for that sunburn to be achieved, but all human skin types can get a sunburn.
Wow, that's really interesting. So now let's talk about, as you know, my generation, we unfortunately, a lot of us were those sun lamp worshipers. We were not very good to our skin. So is there something that we can do now to protect our skin, clearly going on forward, or maybe even reverse any of that damage from the sun lamps or overexposure to the sun?
Sure. Yeah, so I think that's a really important question. Even I abused the tanning bed some in college, and you can't completely undo your past experiences. So even sunburns during early childhood can increase your risk of lifetime of skin cancer. However, UV damage is a cumulative process. So the amount of sun you receive over your lifetime contributes to those changes and risks of skin cancer. So it's never too late to start avoiding the sun. Wearing sunscreen. I think another thing that doesn't get a lot of attention is sun protective clothing and gear. So sunglasses, hats, UV protective shirts, long sleeves, sitting under an umbrella rather than in an open chair at the pool. And these are all little things that can be done. I think it's also important to consider maybe some topical treatments, especially women who are cognizant of fine lines and wrinkles and sunspots. There are both prescription and non-prescription treatments that can help even reverse some of the changes to the skin. There's a lot of stuff out there. It can be very confusing. And for those not doing anything, some of the very basic things you can get started on is one, a sunscreen early in the morning, before you get your day started. You can also use topical vitamin A derivatives. So this is retinol in the over-the-counter form, retinoid in prescription form. And then also antioxidants can be helpful. So applying a vitamin C serum or there are a few other available over-the-counter that people can use. And those are just some simple ways to kind of get started on working on maybe reversing or improving some of the appearance of that sun damage.
Yeah, I like how you mentioned about the protective gear, the long sleeve swimwear, and just even a big hat too, with the big brim, I think is ideal if you're going to be out in the sun for a long time.
Yeah, absolutely.
So annual body checks. So for me, I always make sure that my annual body check with the dermatologist is on my calendar. I schedule it every year. So is there a certain age that you recommend people start getting these on their calendars and start going to visit the dermatologist?
Yeah, that's a great question. So when we look at the evidence of what type of screenings and tests have some value, just in the medicine world in general, we like to look at what is the cost or the time commitment to a patient or to the healthcare system before we recommend any type of annual test. So this is part of the reason that we have extended how long people go between pap smears and mammograms. So the United States Preventive Task Force doesn't issue a recommendation for an annual skin exam for the average healthy patient. And so I think that's important for people to acknowledge that not everyone needs to go to the dermatologist. The primary care doctor is a good person to kind of be a screening or a gate. Yes, you probably do. No, you probably don't. Some things to consider would be a family history of skin cancer. So those with multiple family members with a history of melanoma probably at some point should have a baseline skin exam in adulthood, so 30s or 40s, to establish their risk with a dermatologist. Those with very high mole counts, so 100 nevi or more, probably at some point should have a baseline skin exam. And their dermatologist may say, hey, your moles look very normal, check yourself, you don't need to come in every year. And others, can you hear me, Kate?
Yeah, I can hear you. You're fine.
Okay. And others may say, well, we probably need to keep an eye on you and see you every year. So patients I have that have melanoma skin cancer come in for yearly lifelong skin exams. And those with non-melanoma skin cancer will check in yearly for at least 5 years, after which they don't have to come in.
Okay. Well, that's good to know. So one more question for you. Let's talk about those moles. I know you had talked a little bit about them. So doing self-checks is important just as it is with our normal health. So when you're looking at moles, what exactly is kind of that baseline? What are we looking for?
Sure. So this is where we use the alphabet rule. So A, B, C, and D. So moles that are abnormal are asymmetric. So if you fold that mole in half in any direction, they may be uneven. The color may be different on two sides. B is for border. So the edge of the mole should be smooth and even rather than jagged and irregular. C is for color. So multiple colors within one mole. So a black, a brown, a blue, and a white portion. So more than one color can be a sign that a mole is abnormal. D is diameter. So a diameter greater than 5 millimeters or larger than the size of an average pencil eraser can bring some attention. Now, I think this can scare people because if they have a mole that meets any of those criteria, they worry they have a melanoma. These criteria are just suggestions that that mole may be abnormal, and that would be a lesion that I would have evaluated by either a family doctor or a dermatologist. I think it's also important to notice that if moles are changing, a mole that changes, a mole that grows, a mole that bleeds, those can really be something to be concerned about, and someone should have a look at them.
Thank you. I think that's really good information too, because you have so many moles, honestly, you don't really know what you're looking for, but that was a great explanation of that. So I thank you so much, Dr. Sanford, for taking the time to talk with us. I'm going to make sure that in the comments, I'll link a direct link to Hancock Dermatology where they can connect with you if needed. And I'm also going to post the post we did together because I think it was so informative and we had so many great questions and comments on it. So thank you so much for your time today. I appreciate it.
Oh, you're welcome.
Thank you.